Hello everyone, my name is Denise Francis, LPN, student at Indiana State University Nursing Contract Based Program. Today we'll be speaking about social determinants of health. Our purpose today is to identify social determinants of health and provide interventions. Our learning objectives today will be to identify what are social determinants of health, identify the 6 domains of social determinants of health, identify the percentages of health determinant factors, identify types of social unmet needs among low-income families, identify steps to include in routine internal medical practice, and identify interventions to include with social determinants of health. And remember, as always, there is a pre-test and a post-test, and you will find in the link in the description, and we also have a handout at the end. What is social determinants to health? Social determinants of health are conditions arising from where people are born, live, learn, work, and age, and also accounts for 80% of health outcomes. What are the domains of social determinants of health? Let's see. We have 6 domains of social determinants of health. The first one will be low education, low income, no health insurance, food insecurity, poor housing, and number 6, no or limited employment. What are the percentages of SDH? And again, SDH stands for social determinants of health. The prevalence of different social determinants of health needs include the following. Low education accounts for 16.6%, income 21.8%, no health insurance accounts for 19%, food insecurity accounts for 23%, poor housing 3.3%, and no or limited employment for 21%. And these are the social determinants to health, and these are the needs that's included with that. We have the next we'll be talking about social unmet needs among low-income families. And with social unmet needs, we have 32% of the social determinant to health. 32% of people living in a situation of adults report not having enough money for food. We have 33% reporting having enough money for a balanced meal. So you can imagine 32% of adults reporting not having enough money for food and 33% for a balanced meal. If you don't have money for food, there will be no way you can have money for balanced meals. We have financial insecurity, as indicated by not having enough money to make ends meet or pay bills, was indicated by 90% of adults. 19% of low-income adults reported feeling stressed most or all of the time. And with stress comes depression, and and that's the reason why we have social determinants of health. 9% felt that their neighborhoods were unsafe or extremely unsafe. We have 6% had moved more than once throughout the year. That is not good. So we'll move on. And our next topic will be steps to include in routine internal medical practice. when we talk about routine internal medical practice, we're saying, you know, what medical practice have anything to do with social, determinants to health. It has a lot because for low income people and people without insurance, we can't get no health, they don't get adequate health care. So if we implement policies and procedures or, to help, then maybe we can help these communities to get more health care. So the first thing we plan to do is adoption of professional guidelines from expert panels and professional societies, mean doctors and nurses and higher ups who can put intervention in place, some volunteer services. Also, policy supporting the development of new and adaptable social determinants care models. I mean, government needs to be included in this too as well. We need additional research on the effect of implementing screening and referral programs, referral interventions, and physician burnout on the primary care pipeline. I mean, you have physicians who work in low income neighborhoods and poor rundown hospitals. They have burnout. What can we do to help them? Because we have people who are poor. We take hospitals, for example, they take the emergency room as if that's their doctor's office. If we have, and that's what burning out, some of our physicians, if we implement policies, we can have an promotion of clinical community collaborations. If we promote all of these stuff, then less burnout for physicians, less burnout for healthcare members, and we can provide appropriate reimbursement and healthcare. If we provide appropriate in reimbursement to hospitals and healthcare for people of you know social determinants of health, then we will have a better system where we have less people fall into that category. Okay, we next we'll be talking about interventions. And with interventions, we gonna start with education. Better educational infrastructure. We need to raise awareness on the importance of education and improve access to education for girls and women. With low, I mean, if we start with from early childhood education and everything, then we have a better understanding of improve, improvement in lower income, and because the more education you have, the better job security. Okay, so we have more tolerance regarding education. We need to have financial support for poor families. We need to increase minimum wage. We also need to have improvements in health insurance. And that's one of a major topic that we really need more time on, because I'm telling you, the health insurance these days is something else. We need support for children from difficult family conditions. We need improved quality of teachers, close the teacher gaps. We need to secure food and housing for these people in low income families. And, you know, if we establish some of these interventions in these neighborhoods, then we'll have a better, healthy neighborhoods with less social determinants of health. And next, we have our conclusion. And remember, as always, in my conclusion, I want to say there's a post test in the description. And as always, thank you for listening. There is reference in below, and there's a flyer, that you can help with additional information. And thank you again for listening.